Today's topic is autism spectrum disorder.
Autism is a lifelong disability which affects how people, like me, communicate and interact with the world. There are about 700,000 adults and children on the autism spectrum in the UK. And like everyone, each autistic person has their own strengths and challenges. But all of us have difficulties with communicating and interacting with other people. This could mean not speaking at all, needing longer to process information, or not understanding facial expressions. We also engage in repetitive behaviour, doing or thinking the same thing over and over. This is sometimes for fun, and sometimes to help deal with our anxiety. People on the autism spectrum can also find unexpected changes, however small, very distressing. And then there is sensory overload, where noise, smells, touch, and bright lights become very painful and overwhelming. All these challenges can make the world feel very scary and hard to understand, and sometimes send us into physical and emotional meltdowns or shutdowns. It is very important that autistic people get help from an early age. But life can become very difficult if children or adults don't get the right support or understanding. Autistic children are 3 times more likely to be excluded from school. Only 1 in 6 autistic people in the UK have a full-time job. And over a third of autistic adults have reported serious mental health problems.
Most often, parents already know that their child has autism. They're just waiting for an expert to sit down with them and formally diagnose it. There are times where a parent doesn't know that's going on and comes into the appointment unaware of what it's called.
Now we just have one diagnosis called autism spectrum disorder. Previously, it was broken up into succinct categories, and the categories were to help people understand different levels and different functioning levels of kids and persons with autism. Now it's all one disorder, and then we talk about different severity levels and functioning levels.
Autism is sometimes the A word that you don't want to hear it because you think it's going to be terrible, but autism is a spectrum, and there are children that have just a little bit of autism and who are in the mild range.
So a low-functioning person on the spectrum would have intense behaviors that are impeding their ability to be independent in their life, little to no communication skills, unable to interact with other people and their environment without additional supports. Then you're going to have the higher functioning level spectrum. So in the past it used to be called Asperger's disorder. People who have more of the stereotypic behaviors, repetitive interests, but their communication skills are there. They can communicate with other people, they can interact with others, but they still have some challenges and some barriers in those areas.
So difficulty with socializing with other kids, repetitive behaviors, such as toe walking, rocking, spinning. Those are the classic signs. The kids who are classically autism, you can almost diagnose right in the waiting room as soon as you greet them. They're fairly obvious, and pediatricians are generally good at identifying those.
If they're a young child, some of the things that you want to look for are a lack of eye contact, lack of being able to engage in pretend play. So for example, if you have a toddler and they are not interacting with baby dolls, they're not really using them to try to play, pretend to rock them or put them to bed. Another one would be social interaction. So oftentimes they prefer to be alone as opposed to be with other people. They don't start interacting with other kids. We call that parallel play, moving to more of an interactive play. They prefer to just continue to stay solitary.
The characteristics of autism really differ greatly depending on the person who's diagnosed. When we look at the spectrum, it can be a varied number of things, but the ones we generally see and the ones that you'll find in the diagnosis are the lack of social communication. So it's not just communication in and of itself, the ability to talk or the ability to sign, but rather the ability to communicate socially. Now, that can be a little tricky because just talking vocally is communicating socially, because that's the reason we communicate. But it would include things like picking up on other people's cues when they're disinterested, or understanding when a person is excited by what you're saying, and things like that. So it's a huge kind of umbrella of different things that we're looking at when we talk about social communication. And that's where we see kind of the biggest variance, is that we see plenty of individuals who cannot speak, cannot functionally communicate. And then we see people who have full vocabularies, but when it comes to really interacting, talking about relationships and things like that, that's where they start to suffer. Then the other characteristics we look at are things like interaction ability, their social skills. So are they able to interact with other people? Do they play next to other kids but not actually with them? Do they avoid people altogether? And then up to as much as going on dates and living with a roommate and getting along with professors and teachers and things like that. Jobs, being able to have a job, interview for a job. All of those things would fall under the social skills. So we see deficits in both of those things, the communication as well as the social skills. And then kind of the third big piece is what they kind of refer to as restrictive, repetitive behaviors or beliefs, where they have, it could be something like a stimming behavior where they're flapping their hands or looking at things out of the corner of their eye, things like that. We would consider that to be under that category. But then we also see things like really strong interests that aren't necessarily shared by other people. So they like Thomas the Tank Engine from the time that they're 2 years old until for the rest of their life, or they like Barney, or things like that, or just one thing like maps or lamps. They have this real strong kind of fascination with that, and they don't really move on as a quote unquote typical child would. So there's a lot of things that sort of fall under that as well, or they have routines that are kind of stereotypical or repetitive that they're kind of doing that don't really have a basis in something that would make sense to an onlooker. So those are the ones that we really look at, that social communication piece, the social skills, and then those restricted repetitive behaviors.
Teaching children with autism. Strategies for all educators. The first strategy is to incorporate their special interest into your lessons. Use the special interest to motivate students to do work. If it's something like a fire truck, maybe allow them to read a story about a fire truck, or have them count the rungs on a ladder. Next, have structured routines and procedures. Try and create a structured environment for these students. Put in place a schedule, and then have them stick to that schedule as much as possible. Have set time limits throughout the day. When communicating, speak literally and use direct language. Teachers should avoid speaking figuratively and be precise in the words in which they speak. Also, avoid using sarcasm. The next strategy is to utilize alternative ways of communication. Teachers of ASD students should be well educated in ways to communicate. This includes sign language, communication boards, facilitated communications, and other methods. Use concrete objects to teach the abstract. ASD students have difficulty in understanding the abstract. Realia techniques work well for teaching vocabulary. Teachers should help these children develop their social skills. Teachers can encourage these students to interact with their peers. Have actual lessons that help build social skills and place them in friendly environments. Focus on positive reinforcement strategies, not negative reinforcement. Set up rewards for positive behaviors. Punishing these students will often make the situation worse. Even the idea of punishing students can lead to an automatic shutdown. Be sure to give these students time to process the information being presented to them. Understand that each student will process information at their own pace. Teachers must be patient with their students and try not to rush them. Teachers should limit the amount of time spent on classroom lecture. Provide activities for these students, work with them one-on-one. Remember, we want our students engaged. Next, reduce the amount of environmental stresses. A teacher's tone may cause an increase in stress for autistic students. All it takes is just a slight increase in stress, and these students will suffer high levels of anxiety. As we continue, avoid sensory distractions. These students have hypersensitivities. For example, a loud bell ringing can send a student over the edge. Strong perfume and bright colors will also be distracting. And lastly, you need a viable curriculum. The curriculum should constantly be updated and set to the specific strengths and needs of students with ASD. Engaging lessons will also have a positive effect.